A computed tomography simulation, or CT simulation, is the start of your treatment planning, which follows your initial consultation at our facility. CT simulation includes a CT scan of the area of your body to be treated with radiation. Those CT images acquired during your scan will be reconstructed and used to design the best and most precise treatment plan for you. The simulation ensures that the treatment will target the area of concern while missing surrounding critical structures. As a whole, your CT simulation appointment should last for about 1 to 3 hours, depending on what your doctor has requested. To prepare for the simulation, you'll want to wear loose-fitting clothing, or you can choose to wear one of our provided gowns. Try to have a bowel movement before coming in. Try consuming only light meals 8 hours prior to your simulation appointment. Important: for those who may be diabetic, consume the amount needed to keep you safe. Those who may need to take medication, please be sure to continue taking those medications. Once you arrive at the facility, you'll be given fluids and an enema. You'll remove your shoes and lay down on the table. Then a custom mold will be prepared. This mold will be used for the duration of your radiation in order to immobilize your legs and lower body so each radiation treatment is consistent. The machine's lasers are not at all harmful to the body. The CT simulation is a 3D image which gives the doctors an internal image of your anatomy. This simulation is used to create your radiation treatment plan. After the scan, you'll be given 3 permanent tattoos, the size of a freckle, which will be used as a starting point for your radiation therapy. Paint marks will also be used for better visualization, so it's important not to wash these marks off. Patients usually spend no more than 5 to 10 minutes on the table for their CT simulation appointment. If you'd like to see your CT scan, ask the therapist or oncologist to go over it with you, but understand it is not a diagnostic scan. If the CT scan is unusable because of an empty bladder or excess gas or stool in your rectum, the simulation will need to be repeated. Once the scan is completed, that meets all the requirements, the treatment planning process can begin. Remember, any CT simulation which needs to be repeated will lengthen the time you're here. At the end of this appointment, you and your radiation therapist will create a treatment schedule that will accommodate your needs as best as possible. Your next visit will be your first radiation treatment, typically 3 to 5 business days later. Radiation therapy focuses on the target site, using high-intensity X-ray energy on the cancer, treating as little healthy tissue as possible. Advancements in radiation treatments are more accurate than ever before, resulting in better patient outcomes due to increased precision. Your first treatment session should take about 30 minutes, and each treatment after will take about 15 minutes. The extra time for the first visit allows the doctor to verify the treatment's placement. Your treatments are generally 5 days a week around the same time each day. The number of treatments are determined by the radiation oncologist and may last up to 2 months. In order for you to have the most successful radiation treatment, these are the things you should do to prepare. To dress appropriately for treatments, wear loose-fitting clothing, or you can choose to wear one of our provided gowns. Have a full bladder for each treatment. Try to have a regular bowel movement. Avoid foods that cause bloating or gas, such as dairy, broccoli, carbonated drinks, and foods with extra fiber. During radiation treatment, the arms of the linear accelerator take daily images to ensure accuracy of the treatment. At least once per week, the therapist will check your bladder level and bowel content with a mini CT. The machine is delivering radiation to the target area for approximately 1 to 3 minutes. There is no need to shield or protect the body because the treatment is extremely precise. So remaining as motionless as possible is very important for accuracy of the radiation beam and for your safety. You can see you're approximately 5 feet into the air. You will never be completely left alone. The radiation therapist will exit the treatment room and then observe you with visual and audio monitors throughout your treatment. The therapist can be back in the room within 20 seconds if needed. Once a week, you'll have an OTV or on-treatment visit. During this visit, you'll meet with your doctor after your daily radiation treatment. This is your time to seek help from the doctor, ask questions, and address any concerns you might have. Most patients continue their normal activities during treatments, working, golfing, gardening. However, there may be some side effects, such as fatigue, diarrhea, and bladder issues. Your doctor can discuss the likely side effects and prescribe medication for those who may need it. After the treatment, you pose no threat to those around you. The radiation is not harmful. The more you prepare for your radiation treatment, the better the outcome. For more information, please visit CarolinaSpecialtyOncology.com or give us a call at 919-334-3900.